Hello everyone, Dr. Z here. Today I wanted to talk about prediabetes. The first response I see from patients when I tell them they have prediabetes is an alarm. Let me reassure you, it's not a cause for alarm, it's not a disease, your body is not damaged or in any way. It's just a wake-up call that you're consuming more sugar than your body can handle, than what your pancreas can manage, and that you need to make small tweaks into your lifestyle. So the one thing I want you to understand from this video is the concept of glycemic index, which in the simplest way I can describe it is how quickly a food gives you sugar in the blood after consuming it. So you want to go for things with low glycemic index, so you get low release glucose thing that gives you sustainable energy as opposed to a sugar high and a sugar crash. So if you drink soda or frappuccino or something, they have extremely high amount of carbohydrates, even for the level of sweetness. You can make your own coffee at home and put a teaspoon of honey in it, and that will be sweet enough for you. And that's only 5 grams of carbohydrates. When you go to famous coffee chain syrup that have sometimes corn syrup are very high glucose for the same amount of sweetness. So for 1 cup of coffee at home, you will have 5 grams of sugar. As opposed to store-bought coffee, it will be like 20 to 30 grams of sugar. So make your coffee at home or buy sugar-free from there. And another way you can balance out your glycemic index in the meal is by adding protein, fat, and fiber in every meal. So let's say that cup of coffee or that can of soda is something you're not ready to give up. So what I would do is I would buy the smallest can or the smallest cup of coffee and have developed this mindset that you do not need to drink the last sip. Yeah, just drink as much as you want that you really enjoy. You don't have to finish the whole thing. That's one. Two, add protein, fat, and fiber to it. So then absorption of sugar slows down because of that. So one idea would be to get a boiled egg and an avocado toast with high fiber bread with your coffee and sugar. Absorption of glucose is slowed down. So if you add protein, fat, and fiber in every meal, you can consume small amount of sugar. Whenever you're starting to eat, always start with drinking water because body confuses thirst for hunger. So before you eat any meal, about half an hour before that, drink maybe 1 to 2 cups of water that resets your brain and tells you how hungry you are. Then when you start eating, make sure you focus on nutrition. So you get in your nutrition first. So you eat your salad, you eat whatever fresh produce you can have. You eat your fresh produce, then you go to your protein, so like a grilled chicken or grilled fish or something. Then you can have your dessert. You consume it mindfully in a small amount, and that's all you need to do. Then still eat small portion of everything after nutritional needs of your body. So start from there. Guidelines for American College of Endocrinology, we usually repeat your hemoglobin A1C every 6 months. You can ask your doctor to order it every 6 months. You can go see them. The thing is that a lot of time medication for prediabetes is very underprescribed. So there are some studies that suggest that starting a metformin when you have a prediabetes can increase your pancreatic reserve. It delays the onset of diabetes and it can help you in the long run. So ask your doctor if metformin is an okay thing for you to take. For most people, if you change your lifestyle, you necessarily don't need to go on a medication. But losing weight also helps because the more weight you have, the more insulin resistance you have. Essentially, everything that is good for diabetes is also good for weight loss.